Hey guys, it's James Kim here. This is the most updated version of how to set up a peds liver transplant for the fluid lines. This is exactly how Dr. Ved would like us to do it, so if you just follow this video, I think it would be very worthwhile to follow these instructions prior to going into a liver transplant for a pediatric patient. The way to simplify it is you'll have two fluid lines and then one micro dripper for the pressors themselves. So the two fluid lines depends on how big the patient is. If the patient weighs less than 20 kilograms, you want to use a 60 drop per cc micro dripper. If the patient is greater than 20 kilograms, then you want to use a regular 15 drop per cc dripper. So the first fluid line is right here, and you're going to use a 1 liter bag of Normasol hooked up to a micro dripper. In this case, we're going to assume that this patient is less than 20 kilograms. So it's a typical micro dripper, and if you follow this line down, I have it hooked up to a stopcock here before I hook it up to the actual warmer. Now you trace this warmer down here, and if you keep following me here, this warmer then becomes a 2-port stopcock followed by just a regular adult extension. And this will go to one of the patient's IVs. Then if you follow me to this IV pole, this is the second IV fluid line. Same idea, 1 liter of Normasol hooked up again to a micro dripper. But in this case, this does not run through the warmer. This is just a simple setup that hooks up the micro dripper directly to a two-way stopcock, 2-port stopcock, then distally hooked up to, again, an adult extension, just like this line. So if you look at the table here, the way I have it taped up, these two lines, these two double stopcocks, will be our fluid lines for fluid administration and for medications. Then if you follow me back up here, this is the micro dripper used for our pressors. So you use a 500 cc normal saline bag. You hook that up to a micro dripper, and this micro dripper, if you follow it and track it down here, is set up to one of these quadruple ports. So these 4 ports are then connected distally to a pediatric extension, which, as you can see, is much thinner than these adults. Now on these quad ports, you're going to hook up 3 different fluids and medications. The first one will be dextrose 10%. The second port will be dopamine, and the third port will be epinephrine. And if you follow me up here, you can see that this is where they're hung. So you have the D10 up here, followed by the dopamine here, and then the epinephrine, which is 2 milligrams mixed into 100 cc's, which comes out to a total of 20 micrograms per cc. So that is the concentration of the epinephrine. And like I said, so these 3 ports, or these 3 drips, will go into these 3 ports down here. And then lastly, on this IV pole, you also want to take a 250 cc 5% albumin and spike it and prime it on a regular 15 drop per cc dripper, and have it primed with a stopcock just in case you want to hook this stopcock up to this one here, and you can push and pull albumin as needed, as the patient needs. So just have that primed and ready to go and have hanging in the back. And then if you might be wondering what the second warmer is used for on this IV pole. The second warmer is hooked up just like a regular adult bloodline. So you have the bloodline here with the 2 ports, and distally to the warmer, it's like I said, it's the adult setup. So you have the regular adult extension. The difference now is that we are not priming this. We leave this as is, empty, as you can see here, so that when the patient comes back, we can hook up 1 unit of red blood cells and 1 unit of FFP, mix that in a 1-to-1 ratio, and prime this line set with the blood product itself. So leave this ready to go, but not primed with any fluids. And last but not least, I just want to talk about the triple transducer. The setup will be just like the adult, except in the pediatric population, we never float a Swan-Ganz PA catheter. So you won't need this yellow port, but you will still need the radial A line, the femoral A line, and the CVP. So that's pretty much the basic setup for the lines when you are dealing with a pediatric liver transplant.